Good morning, everybody. Hi. We're going to thank you so much for coming to our GM Creative Health Conference. Before we start the conference, kind of the talky bit, and there is a bit of activity in there as well, we're going to have a kind of a precursor, so a little entree, which is Company Chameleon, performing a short excerpt of their piece, Witness This. Kevin, are you here? Ah, there you are. Kevin's going to introduce the piece. It's about 6 minutes long, and then we're going to ask a couple of questions, and then we'll get that. Then it'll be 10:30, and we will start the conference bit proper. Okay, so I'll hand you over to Kevin from Company Chameleon.
Oh, thank you so much, Julie. I really appreciate that. Hello, everybody. Really wonderful to be here. Thank you so much for the invitation to be part of the day today and to share the work. So, Company Chameleon is a dance company based in Manchester. We've been operating for around about 17 years now. There's a huge variety and spread of work that we do, but what's more relevant to the conference today and why we're here today is we've been involved in the creative health sector now for about 10 years. And that all came from my own personal journey and story with mental health. I have serious mental health conditions of bipolar and schizophrenia. I had a really challenging time, a crisis around about 10 years ago where I had to spend some time, I got sectioned twice into the Mental Health Act, so I had to spend some time in hospital, which you can imagine wasn't the nicest experience ever. But when I was inside hospital, the only times where I actually got some respite was when I was involved in a visual arts workshop and when I did a bit of drumming. So when I left hospital, it was really important for me to go, okay, well, first of all, I've got to try and get back to work, which luckily I did, from the support of the people that loved and cared for me. But the next thing was, okay, I'd really love to go back into secure mental health context and do some workshops, because I know how much it helped me. And I also wanted to make some work in order to kind of raise awareness around these really important issues. So I could talk about this all day, but I'm not going to. But I just want to let you know that creative health has been a big part of my practice now for the past 10 years. And the piece that you're going to see tonight is a piece called Witness This that was commissioned by Without Walls in 2017. It's an outdoor version of a much bigger indoor version. It's a little bit of a 6 or 7 minute extract. And the piece, again, is about mental health more broadly, but about the experiences that I went through my crisis, but more importantly, how that impacted the rest of my family and community and loved ones around me. You're going to see the very beginning of that. So I think I've probably talked enough. So yeah, I hope you enjoy it. Thanks.
Thank you so much, Company Chameleon. Best way ever to start a conference. We've got a few minutes just while other people arrive, and just want to ask Kevin a couple of questions, if that's all right. So can you tell us why dance and mental health?
Yeah, sometimes things can't be described or articulated through words, or sometimes words for certain people are not the best way to be able to express themselves. So I think having movement, being physical, embodying the whole of you can really allow yourself to kind of process some of that stuff. And I think sometimes having a non-verbal way of being able to do that is really, really important. Because like I said before, some things can't be expressed in words. But what I will also say, and I'm sure you can hear this on lots of the applications that I've written, is
some of those people are in the room now.
Oh yeah,
let's move forward.
Oh yeah, let's move. We've got chairs.
We could have a chair.
Yeah. So I think what's really good about movement, dance, and mental health is that you get all the physical stuff that you get from sports. So you're getting your flexibility, your strength, your coordination, all these fantastic physical attributes and benefits. But then also, you get an opportunity to express your internal world. And that's so incredibly cathartic and so incredibly important. And also there's the whole social and collaborative and communicative aspects of being involved in a creative process. So that's why for me, obviously I'm biased, but that's why I think for me movement and dance is such a great way and a great tool to be used in creative health, because I think for all those reasons I stated, it can kind of get to the real source of what it is that somebody is feeling, experiencing, and needs to express.
Thank you. And no, that's a great answer. So in practice, what does that mean? So I know that you do a lot of work with young people. So what does that look like in practice in Greater Manchester? So
in actual practice, we were very fortunate enough to be funded by the Bearing Foundation, which is an incredible organisation. And the project that those guys have supported is a schools project that we have called Movement for Mind. So we're going to go into 10 different high schools over a 3-year period, and it's a 6-week process. So what we do is we go into the school at the beginning of the process, and we show the full work of Witness This, which is 35 minutes long. It's quite hard-hitting, and we don't pull any punches. We have a little bit of a conversation and Q&A session with the young people so they can give us their response back to the performance work. And then we go on a 6-week process with them where we explore what does mental health mean to them, individually, societally. We'd look at issues around needs and how do we articulate our needs, how do we understand our needs. And it's all within the framework of a creative process so that throughout the 6 weeks, they're looking each week at a different kind of idea. And towards the end of the process, they have a creative outcome. And what's really beautiful is then the artists go back to watch what they perform in their school context. And it's really, really lovely. And we've got some really hard data as well, because everybody likes evidence-based on how people are at the beginning of the process and where they are at the end of the process. So in real practical terms, that's a project there where I think where it really supports the young people involved, because the young people that we're working with is we work with the Be Well, and we look at some of their data and survey. We're working with those guys closely. So we've been trying to go to the areas of most need, number one. And number two, we've been working with young people who are either at risk of being on CAMS or currently using CAMS services. And for me, it's like a kind of recognition of, although there's lots of amazing people doing lots of amazing work, I think we all realize how underfunded these kind of areas of work are, especially with young people. So for me, it's kind of like, and for the company, it's our response to that, really. So that's what it looks like practically on the ground.
Okay. And finally, what's the one, apart from money, obviously, what's like the one thing do you think that would make your work easier to access for those people that need it? That's a really tough question.
I think it's about getting the right people together in the room. I remember, because Julie and I've known Julie for quite a while, and we've worked together in different things and being part of the Creative Health strategy as well. It's artists, in every single sector there's jargon and there's language that people use within that sector. So it's about how can we navigate through that language, how can we get people who are working in the health sector commissioning those who work in the arts sector, and this is what this is all about, really, isn't it? All the wonderful things that are involved in this strategy, I think, are addressing that. But I think for me it's that, you know, how do we develop those conversations, how do we bridge those relationships so that, you know, there's so many amazing artists in the city region with such a wealth of experience, not only in their practice, but working with people. And I think we need to tap into that resource, get the right people together in the right rooms, which you are doing, and which we are all doing. And yeah, focus on action.
Brilliant, thank you ever so much. Thank you very much to Kevin and to Company Chameleon.
Thanks, Julie, for the opportunity.